Hi, my name is Karen Tapper and I will be sharing information about cesarean sections. A cesarean section, more commonly called C-section, is a surgical delivery of a baby. The number of cesarean sections performed in America has been steadily rising over the years. According to the Centers for Disease Control and Prevention, about 32.2% of babies are born via cesarean section, well above the 10 to 15% that the World Health Organization deems to be a normal rate. There are many reasons why a doctor may opt to deliver a baby via cesarean section rather than a traditional vaginal birth. I'm going to share with you those reasons, as well as the risks and benefits to having a cesarean section birth. But first, let's look at the history of cesarean sections. It was often thought that the cesarean birth was named after the Emperor Julius Caesar. And depending on the source, it's still reported that that's the origin of its name. It was believed that he was the first person to be born via cesarean delivery. However, other reports state that the term is actually derived from the Latin word cardere, which means to cut. Initially, cesarean sections were performed to extract the baby from a mother who was near death or had already died during the childbirth process. Neither the mother nor the child was expected to survive. The leading cause of death for the mother was shock or infection from the incision, while the leading cause of death for the baby was hypoxia. The first recordings of mother and child surviving this procedure started to appear in the 1500s. A cesarean section is considered major surgery. It is performed by first administering anesthesia to the mother, and there are three choices of anesthesia offered: a spinal block, an epidural, or a general anesthesia, which is typically reserved for emergency situations. Once the mother is properly anesthetized, an incision is made in her abdomen, a laparotomy. Then, a second incision is made in the uterus, a hysterotomy. The baby is then removed from the uterus. 95% of the incisions are low transverse incisions, just above the pubic hairline. Under special circumstances, however, the doctor may use a vertical incision, which is from the umbilicus to the pubic hairline. There are times when a traditional vaginal birth can impose a risk to the mother and or the unborn child, and a cesarean birth is recommended and planned in advance. These reasons can include the mother being pregnant with multiple babies, the mother having had a previous cesarean section, or for health reasons such as heart disease, hypertension, or an active herpes infection. A cesarean section may also be performed if the fetus is not in the cephalopelvic position, the fetus's head is thought to be too big to pass through the mother's pelvis, or there are developmental issues with the fetus. While cesarean sections are generally avoided before 39 weeks of pregnancy to allow for proper development of the fetus, in emergency situations this may be unavoidable. Emergency cesarean sections are performed also when complications arise during labor that can cause harm to the mother or the unborn child. For the baby, there's some risks to be considered when being born via cesarean section. One is possibly being injured by the incision. Secondly, studies have shown that the microbiome of a cesarean baby lacks strains of certain healthy bacteria that are found in children delivered vaginally, and is also prone to harboring disease-causing bacteria. Though more research needs to be done, it is thought that this predisposes these babies to a higher risk of developing asthma, eczema, and becoming obese. Finally, if the baby is delivered before the 39-week mark, there's an increased risk of health problems, particularly breathing issues. For the mother, there's a longer recovery time after having a cesarean section when compared to a vaginal birth. Also, repeated cesarean births can increase the risk of bladder and bowel injuries and also increase the risk of problems with the placenta in future pregnancies. Along with that, one needs to also be concerned about the typical complications that may arise after having any major surgery. This includes infection from the incisions, developing thrombosis, and hemorrhaging. Poor scar healing is also a risk of surgery, and while it's not necessarily life-threatening, this can lead to esteem issues for the mother. Here, you see a picture of normal scar healing compared with a hypertrophic scar and also a scar that has formed a keloid. The benefit of a cesarean section is life. Unlike cesarean sections of the past, where there was the expectation of death for both the mother and the child, now, thanks to advances in modern medicine like anesthesia and antibiotics, a cesarean section can be life-saving, and that far outweighs any of the risks.